Young children are likely to get between 6 and 12 colds each year. Hi, I'm Dr. Beth, and I'm a pediatrician at SickKids. Let's talk about the common cold and the 5 important things that can help you care for your child when they're sick. What is a cold? The common cold, also known as a viral upper respiratory infection, is an infection of the nose and throat caused by a virus. While many of the viruses that cause colds are more common in the winter months, you don't actually catch the virus from being out in the cold weather. Having multiple colds does not necessarily mean your child has a weak immune system. Over time, repeated exposure to different viruses helps your child develop immunity to them. As your child gets older, they tend to get sick less often. Cause of the common cold. There are many different viruses, up to 200 that can cause a cold, but rhinoviruses are the most common type. Cold viruses spread easily. You can get a cold if a person with a cold coughs, sneezes, or doesn't wash their hands. Droplets from a cough or sneeze can reach your nose or mouth. Or you can touch a surface contaminated with cold germs. Children often get colds from family members, playmates, and caregivers, especially those who attend daycare or have siblings. Common symptoms of the common cold. When your child has a cold, they may have a range of symptoms, including a runny or stuffy nose, sneezing, coughing, fever, sore throat, or red eyes. If there's fever, it usually occurs in the first few days of the cold and goes away before the other symptoms do. Most colds last for about 1 week, but some can linger, particularly the cough, which may persist for up to 3 weeks. 5 important things that can help you care for your child. 1. Congestion. Babies especially have difficulty sleeping and feeding when their nose is blocked. One way of making them feel a little more comfortable is by unblocking their nose so they can feed and sleep. Saline or saltwater drops can be placed into your baby's nose to help loosen mucus. These nasal drops are available over the counter. You can use 2 to 3 drops in each nostril several times a day, especially before feeding and bedtime. Using a soft rubber suction bulb or nasal aspirator can also help remove mucus from young babies' nostrils, allowing them to breathe more comfortably. A cool mist vaporizer or humidifier in your child's bedroom may also help loosen mucus. Remember to clean the vaporizer or humidifier regularly. 2. Fever management. If your child has a fever and is uncomfortable, you can give them acetaminophen or ibuprofen. Follow the dosing instructions on the box of the medication to know how much to give and how often. 3. Cough. For most children, the cough is just a symptom of the cold and will improve as the virus runs its course and the congestion improves. There are no over-the-counter cough or cold medicines that are recommended for children. However, children over 1 year of age can take 1 to 2 teaspoons of pasteurized honey as needed to ease a cough. Remember that it is never safe to give babies under 1 year of age honey. 4. Prevent spread. To reduce the spread of colds, the most important thing you can do is practice good hand hygiene. Wash your hands and your child's hands frequently, especially after coughing, sneezing, wiping their nose, or coming into contact with someone who has a cold. 5. Be on the lookout for worsening symptoms. Most children can be cared for at home when they have a cold, but it's important to watch your child's symptoms for changes that would warrant seeing a healthcare provider. When to consult a healthcare provider. If your child is younger than 3 months old and has a fever. If your baby cannot drink enough fluid because their nose is too stuffy. If your child develops a fever several days after the start of a cold, this may be a sign of an ear infection or pneumonia. If your child's fever lasts more than 5 days. If your child has ear pain or fluid draining from the ear. If your child develops any signs of difficulty breathing or you're concerned about your child's cough. A worsening cough could be a sign of a complication or another condition, such as bronchiolitis, pneumonia, croup, or asthma. I hope you found this video helpful. Subscribe and visit aboutkidshealth.ca for more. Thanks for watching. Stay healthy, everyone.